This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Hi, everyone. My name is Michael. I'm a PGY4 at the UCLA Greater Los Angeles VA program. I'll be presenting in the next 20 minutes about the program and who we are. So, here's an overview of what we'll talk about, who we are. I'll go over some details about the rotation, some of the skills we perform, where we go after we graduate, where the residents currently live, some of the benefits we have, and then lots of photos. So what are we like? We're a diverse program with varying backgrounds and interests. In total, we have 25 residents, anywhere from 8 to 9 per year. Every third year, we have 9, and then we are an advanced program. And this is our most recent graduating class. Dr. Aragaki, our program director, is in the middle. 3 of our graduating class went to pain fellowships, 2 did interventional spine, and then the 3 did general PM&R. All right, we have an amazing, friendly faculty. Unfortunately, we have we work with so many faculty that if I listed all of them, it would take the full 20 minutes. So instead, I'll go over these 2 pictures. We have Dr. Fish and Dr. Chen here, who are 2 of the attendings we work with at the UCLA Spine Center. Dr. Vu is our inpatient attending in the VA. Dr. Eben is the chief of PM&R at the VA. And then we have Dr. Pham, who's the program director for the pain fellowship at the VA, but we also work with her outpatient-wise at the VA. And then Dr. Nasasi, we work with at the Sepulveda location. And then this is Dr. Aragaki, our program director. So I'll go over some of the rotations that we do and some of the sites that we work at next. So our main site is the West Los Angeles VA Center. This is where we do the majority of our rotations, both ARU, consults, and outpatient. And we also have our didactics every Tuesday afternoon here as well. So for the acute rehab unit, we get amazing exposure to stroke, amputee, postoperative, orthopedic, and neurosurgical care. We work with 2 inpatient attendings here, and then we also have continuity clinic so that we can follow up with the patients that get discharged to kind of see how their transition were back out into the community. Here we take home call, where we take a pager home with us from Monday to Sunday. We're on call typically 2 weeks out of a 6-week block, and then we go in on the weekends around very briefly and see if we get any consults as well. We have outpatient clinics here at the West LA VA. The clinics are they just vary throughout the week. We'll have half days of doing EMG nerve conduction studies. We also get general MSK here. We work extensively in the pain clinic and the chronic pain clinics with the pain attendings. And then there's also neurolysis clinic. We get extensive early exposure to EMG nerve conduction studies. So the way our rotations work is actually as a PGY2, we do a lot of outpatient. And since we don't have like an EMG or nerve conduction study dedicated block, instead it's just spread throughout our outpatient clinics. And then we do a high volume of procedures. We use botulinum toxin for migraines, and we also use them for spasticity and neurolysis clinic. We do a lot of ultrasound guided joint injections and soft tissue injections. We also use ultrasound for diagnostically with the sports medicine attending at the VA. We do neuroaxial interventions with the pain faculty and backup and pump refills at the pain clinic as well. And then we do consults at the West LA VA as well. Here we do general consults for the acute rehab, and then we also do cardiopulm consults where we go up to the cardiac ICU. And if the patients are ready, then we prescribe a cardiopulm rehab program. We also just started last year the long COVID clinic. And so one of our pain attendings and one of the PM&R attendings staff that. So we also get a chance to rotate and work with veterans that have long COVID symptoms. Our next site is Sepulveda VA. This is where we also do ambulatory outpatient clinic. And then fun fact, the Sepulveda VA building is actually where they filmed the bridge scene in Grey's Anatomy. So here we still get more EMG nerve conduction exposure. We actually have dedicated injection clinic days. So we have patients loaded up just to do injections. And then we also have our general MSK clinic and follow-up visits as well. We also rotate at the UCLA Spine Center, UCLA Santa Monica, and UCLA Ronald Reagan. These sites, we get extensive interventional spine exposure. We get to participate and do neuroaxial procedures. As a resident, we work with the pain fellows as well. And then with this rotation, we also do other clinics like the neurology clinic, neuromuscular clinic, amputee, wheelchair, and even inpatient pain consults as well. Our next site is California Rehab Institute. This is one of the largest inpatient ARUs on the West Coast. It is a private rehab institute. So it's kind of nice because we get a little bit diversity and kind of see how a private rehab institution would work and function. Because of that, we get a lot of VIP population patients that come from Cedars, UCLA, Cal Rehab being close to Beverly Hills as well. But we also get a lot of Medicare, Medi-Cal patients that come through. Here we take in-house call from 7 a.m. to 7 p.m. and for 7 days or 1 week at a time. And then after 7 p.m., we hand off the phone to the overnight hospitalist that covers the hospital. And then same thing, we're roughly on call 2 weeks per 6-week block here. Cal Rehab is near Westfield Century City Mall, so we like to go out for lunch breaks, grab boba, go out for lunch, go shopping. And our work room is actually at the highest floor of this building, and so we get really nice views of Los Angeles. And then in the workroom, we have unlimited coffee. And once a week, the faculty there like to run lunch lectures, so we get lunch then as well. All right. Next, we also rotate at Rancho Los Amigos, where we get our dedicated traumatic brain injury rotation. This is a world famous rehab center. It's known for creating the Rancho TBI scale. We work with hands-on with attendings that are TBI trained, and this is by far one of the rotations where we get the most exposure for doing Botox injections for spasticity. Because the site is a little bit far, we also get the nice benefit of having free breakfast and lunch every day. And Rancho Los Amigos is a county hospital, so we get to work with, a lot of the underserved population, a lot of Spanish-speaking population as well here. And they recently remodeled, so it's the new rehab facility. We get our 2 months of PEDS experience at the Children's Hospital of Los Angeles. This is one of the top 5 pediatric hospitals and a brand new rehab unit. You get a comprehensive pediatric rehab experience from traumatic brain injury, spinal cord injury, normal bread and butter orthopedic rehab cases, and a lot of rare cases as well. What the attending we work with is one of the leaders in PEDS rehab, Dr. Craig, and he's typically an international guest speaker for PEDS rehab as well. And we also work with a very diverse population here. So for our dedicated spinal cord injury rotation, we go to the Long Beach VA. It is one of the largest dedicated spinal cord injury centers in the VA system, and it's also home to UC Irvine's Spinal Cord Injury Fellowship. We get an amazing didactic experience here. The attendings all love to teach, and we get like 2 half days of teaching every week where we, learn about the complications of spinal cord injuries, and then we also get to trial wheelchairs, adaptive sports, and a lot of us will walk away after this rotation feeling very confident taking care of patients with spinal cord injuries. All right, so our approximate call schedule. So the way our kind of rotation works is we're typically at the VA ARU. We have 2 6-week blocks, so 3 months in total. And we typically are on call 2 weeks out of a 6-week period. So in total, 4 weeks here. And then with the VA consults, we do 3 months of that, and we're on call 2 weeks out of that 3-month period. At CHLA, our rotation is 2 months in length, and then we work 4 weekend days where we just go in and see the patients in round. And then at Cal Rehab, we have in total 4.5 months, 1 6-week block, and then 1 3-month block. And on average, we're on call 2 weeks out of every 6 weeks. So we have around 6 weeks of call here. Most rotations are 8 to 4:30 unless you're on call. And in total, this equates to about 14 weekends over 3 years that we end up working. And in terms of inpatient, outpatient, it kind of varies. Dr. Aragaki will kind of let you know when you join kind of what your rotations are, and like in the very beginning for all 3 years. But I would say primarily in PGY 2 year, we do a lot of outpatient in the beginning. So we sent out a survey to alumni and recently graduating residents to kind of see what they feel most confident doing about leaving our program. And some of the results, some people said, they feel confident managing acute rehab patients at the acute level, medically optimizing spinal cord injury and traumatic brain injury patients. A lot of people have said they're confident doing ultrasound-guided joint and soft tissue injections, and very confident doing electrodiagnostics with EMG and nerve conduction studies. And then just being able to treat patients in a lot of different settings, from the county, hospital, VA, academic, and even private with Cal Rehab. So we get a lot of training in different systems and different EMRs. So we get, we end up using CPRS at the VA, Epic, and Cerner as well. So where do we go after? So in the past 3 years, our residents have gone on to do a pain fellowship, a sports fellowship, spinal cord injury fellowship. One of my co-residents is currently applying for a TBI fellowship. And then some of us also go and do a non-accredited spine fellowship. And then otherwise, it's general inpatient, outpatient, PM&R, and subacute consulting as well. Some of the fellowship ties for our program hosts one of the few PM&R ACGME accredited pain fellowships in California. And because of that, we get plenty of experience in chronic pain clinics with pain attendings when we rotate at the West LA VA. And then we also have a close relationship with West Coast Sports Foundation, and they host the ACGME Harbor UCLA Sports Medicine Fellowship. And we are closely associated with them through the Team to Win program, where we provide sideline sports coverage for high schools around the Los Angeles area that can't afford to have a doctor on the field. And then our program rotates closely with the program director for the UC Irvine Long Beach Spinal Cord Injury Fellowship Program. And some of our alumni have actually gone on to create a PM&R Spine Medicine Fellowship at UCLA as well. And then speaking of alumni, we have an extensive alumni network that reaches all over SoCal and the US as well. And this is great for, just being able to look for fellowships and job hunting. We talk to alumni, they come back and they give us guest lectures during our didactics. We see them at our annual meeting at the AAP-MENAR, and then they also hold mixers for board preps and a lot more. Now, our program would definitely not be where it is today without, our fearless leader, Dr. Aragaki. She is by far the best program director in the world. We call her Mama Gaki because she treats us like we're her family. She will fight, really hard to make sure we get anything we need, and basically feel confident when we leave, the program to do anything that we want to do. She holds a leadership position at AAP, and then she is a UCLA faculty as well. And then everywhere we interview for jobs or fellowship, people will, recognize Dr. Aragaki and tell us to basically say hi to her. Now, there are some downsides to our program. You must have a car. Los Angeles being Los Angeles, it's notorious for having really bad traffic. And so you need a car to get around. We do rotate at, a lot of different sites that require commuting. However, a lot of these sites that we rotate at, if you live at the West LA area, it's actually a reverse direction of traffic. And there's always typically 2 residents at each site. So then we end up carpooling as well. Most shifts end before 5 p.m. So driving, you won't really end up driving tired or fatigued. But if you do, UCLA, we have Ubers that we can order for fatigue mitigation as well. And then research can be slow, especially if it's done at the VA, especially if you're trying to do clinical research where you're recruiting patients and such. The paperwork can take a long time. But we are all involved in a research project for the whole 3 years that we're there. And it's both required as well. So that's not to say that research is impossible. And then we do a lot of other scholarly activities like book chapters, case reports, and then reviews as well. So this is a map of just the different sites that we rotate at. This is the Long Beach VA, Rancho, and Downey here. And then in Hollywood, we have CHLA. And then we have Cal Rehab, the VA, and UCLA here as well. So some of the sites we do have to drive pretty far away, but again, it's reverse traffic. In terms of research, if you want to do more, we can do 1 month of selective research where you can just use kind of the elective time to do extra clinical opportunities or more research. And conference attendance to AP&R is approved as a senior, but potentially as a junior if you end up having something to present. And then we also the UCLA supports us in terms of going to other conferences as well. Like I went to AMSSM this year to present a case with our current chief resident, Liz. And then we also do a lot of volunteering and teaching as well. In terms of volunteer experiences, we go and help out at the UCLA mobile clinic where, it's a free clinic for, the homeless or the underserved population. We work with Team to Win or West Coast Sports Foundation to provide sports coverage. We also do adaptive sports coverage and volunteer as well. We work closely with the UCLA Student Interest Group, and we host and teach and have EMG nerve conduction study workshops for them. Dr. Pham is one of the MSK block chairs for the first year med students at UCLA. So we actually end up teaching them physical exam skills as part of their block. And then we also interact with a lot of rotating medical students at the various sites as well. In terms of didactics, it's every Tuesday afternoon. And we have, anatomy lecture series and EMG nerve conduction lecture series. And that's typically in the beginning of the academic year. And then otherwise we have, other blocks of orthotics, bracing, prosthetics, and gait as well. All right, so what is it like to live in LA? Well, Los Angeles is amazing for outdoor stuff. The weather, as you can see, is very consistent. It's always sunny. And we're close to skiing and snowboarding. It's an hour away to Big Bear. And Dr. Pham, typically like pre-COVID, would host us for an annual ski and snowboarding trip at Big Bear. And then we also have a lot of beach days as well for the people who love to surf. Where do a lot of us live? Majority of us will live around the West LA area, where on average, a 2-bedroom, 2-bath can be anywhere from $2,500 to $4,000, just kind of depending on the amenities you want. I currently live in a 1-bedroom by myself, and I definitely pay the lower end of $1,750, but I've seen 1-bedroom apartments go up to like $2,024 or like even $2,400. The cost of living in LA is really high, especially if you're living alone. But with that, we do get a housing stipend because we're part of UCLA and part of the union. And the housing stipend is currently about $1,000 a month. In addition to other benefits, we do educational dinners, we have didactics, we get to teach UCLA medical students, we get an education fund. As a PGY2, you get relocation fund as well. And then we get $3,000 per year to the UCLA cafeteria. And then we also get $200 Uber Eats every month at different approved site rotations. And then we get excellent medical coverage. And I will have a disclaimer for all these benefits. The UCLA union is currently negotiating a new contract for the next 3 years. So some of these benefits might change, might go up, might go down. I'm just not sure. We get great healthcare throughout UCLA, includes dental, vision, amazing low copays. We have family coverage, and you can go to pretty much any site you want in terms of UCLA. All right, lots of photos here. So, we do a lot of volunteering events. Here we are volunteering at a wheelchair basketball Angel City Sports Expo event. We have our chief resident, Liz, presenting at the AMSSM conference. We like to go out to dinners. And then here we are at a gathering with our program director, Dr. Aragaki. We like to do rooftop brunches. Residents like to host, dinners in the backyards and then just dinner out at restaurants as well. We like to do happy hour, more scholarly activities, and this is our PGY2 now 3 class. We like to go out to, sporting events, Laker games, Dodger games, and here is a wheelchair day at the Long Beach VA for our SCI rotation. We also use, VR to practice injections. And we like to take advantage of the outdoors, the amazing weather, and kind of learn outdoors as well. And just more, I think this is David and our other chief resident, Grace, kind of just feeding the ducks during their lunch break at the Sepulveda VA. And that's it. And let me open up chat and answer a few questions. I think I still have some time. If I probably won't get through everything, so if people have other questions, feel free to email us at uclarehab@gmail.com. And we also have Instagram at UCLA VA _residency.
Mike, actually,
I don't think I have
you
time.
timed it just right. That's
Perfect.
20 minutes right there.
All right.
Well, thank you so much to the UCLA folks.